ADHD can make things very difficult. It can make it hard with work, it can make it hard to follow tasks. So just to kind of make those things a little bit simpler, it is good to have a diagnosis.
Welcome to VNA Today. I'm your host, David Miranda. ADHD is one of the most common childhood developmental disorders, and it can often continue to affect people's daily life well into adulthood. Joining us now with more information is VNA Healthcare's Joanna Toporkovich.
ADHD is attention deficit hyperactivity disorder. It is something that is really common in childhood, and it is a disorder that can last all the way into adulthood. There is actually couple variations. So there's the type where you have the attention deficit. So you have a hard time focusing, a hard time kind of staying on task, you get very distracted. And then the hyperactivity part one is, you're very fidgety, you talk a lot, you tend to interrupt. It's a little bit more active based. Some people actually have a combination of the two. There's no one particular test to diagnose ADHD. There are lists of symptoms for each, and children up to the age of 16 have to meet 6 criteria, and then anyone 17 and older have to meet 5. There's also a lot of other things that kind of go hand in hand with having ADHD, such as depression, other mental health disorders. So by managing ADHD, you would then get a better handle on the other things. And then it's a good idea to kind of manage both, so you could kind of have a balance between the two. The treatment for ADHD can include either behavioral therapies and medication. It's helpful also for parents with children who have ADHD to get some help, because they may need a little bit of extra therapy or counseling on how to manage their child's symptoms and how to help them best. If you're noticing some of these symptoms within your child, it's a good idea to talk to your child's teacher. If these things are happening at home, it's more than likely that they're happening at school too, so it's good to kind of get that perspective as well. They may be having behavioral issues, they may be talking out of turn, having a hard time focusing. So if you're noticing any symptoms, definitely reach out and speak with the teacher as well. Here at VNA, we have a lot of really qualified mental health professionals who can help you get that diagnosis and find what therapies work best for you, so that way you can manage your symptoms and live the best you can.
Thank you so much, Joanna. For more information or to make an appointment with VNA Healthcare's mental and behavioral health providers, visit us online at vnahealth.com or call us at 630-884-4566. I'm your host, David Miranda, and see you next time.